Dr. Robert Farivar at Saint Alphonsus specializes in cardiothoracic surgery, specifically in minimally invasive heart valve repair and replacement. We had the chance to learn more about him and his team's life-saving work. Dr. Farivar, help us understand what made you interested in pursuing a career in the medical field, let alone being a cardiovascular surgeon?
Well, it's very personal. I was 16 years old, and my father, who's a physician, passed out in front of me. And when I looked down, his eyes were wide open. And I said, "You didn't pass out." I said, "What happened?" He said, "Well, I think I have some heartburn." And that's when I knew it was a heart attack. And so I asked my mother and cousin to put him in a car, and we did. And he was 39 years old at the time.
Wow.
And he had a heart attack.
That's relatively young.
It's very young. And 10 years later, at 49, he had a coronary artery bypass, a cabbage surgery. And he's over 80 now and doing great and still working. So that really affected me.
My goodness. Okay. Help us understand then, what's the difference between a cardiologist and a cardiothoracic surgeon?
That's a great question. There's a lot of confusion among that. Yeah. Cardiologists are physicians who are specialty trained through internal medicine with advanced training in disorders of the heart. Cardiothoracic surgeons are surgeons who are specialty trained in how to treat the heart. So for example, a cardiologist works with a needle and a cardiac surgeon works with a scalpel.
Okay, and let's talk about too the cardiothoracic program here at Saint Alphonsus, because I understand recently you received a very significant designation. Tell us about that.
Recently we were designated 3-star in the Society of Thoracic Surgeons aortic valve replacement program. We always say 3 stars is the highest distinction because people say, is that out of 5 or out of 10? Yeah. No, it's out of 3, which puts us in the top few percentile in the country for valve surgery. And you can only get this 3-star designation if you do enough of the surgery and you have excellent enough outcomes in the surgery and in the long term to be categorized in that top few percentile. It's a really hard distinction to get, and the team is very proud of this distinction.
What makes this program here at Saint Alphonsus different than other programs?
Well, we have an excellent team, and I'll say the team always does the right thing for the patient. One of the things that distinguishes our program is we have all the equipment to do the most up-to-date procedures that you'd find anywhere in the country. So we do complex aortic work, reoperations, octogenarians and nonagenarians. We have a robust valve clinic with the cardiologist where we can perform TAVR or MitraClip or clinical trials for mitrals.
How do these procedures here at Saint Alphonsus benefit them?
Well, the heart can be in good shape, or the heart can be sick because you've had a heart attack, for example. Many surgeons won't operate on the patients whose hearts are very sick because they're worried the patient won't do well. We have, for example, ventricular assist devices called the Impella for the left and right heart that can support the heart after surgery. So we can offer you surgery even if you're very sick. Additionally, let's say you've had cardiac surgery in the past, a bypass or a valve, and after time it's either failed or worn out. We can redo the cardiac surgery that's been previously found not to be acceptable. That's a big deal. Redo cardiac surgery is something that carries significant morbidity and mortality and requires specialized expertise. So we could also do that. The other thing, though, is we can take care of all the issues that people have when they come to the cardiologist and to the surgeon, and I compare it to going to an auto dealership. You can go in and get everything fixed at once. You don't have to keep going back and coming out and seeing if it worked. We fix everything at one time so that once you're done, you're completely revascularized, you're completely fixed, and you have your best chance of living longer and feeling better.
Where can our viewers go so they can learn more about the cardiothoracic program here at Saint Alphonsus?
Saint Alphonsus has a website that we'll be happy to provide you the link that'll get you in touch with all the right people.
Wonderful. Thank you so much.
Thank you. Thank you for having me.